Hi, everyone, fellow labor brothers and sisters. My name is Christine Pettit. I'm going to be splitting this time with Vincent Viernes, my colleague. Thank you, Sparrow, for the invitation. Basically, we're representing PEF, Division 279, which represents the Office of Mental Health and OASIS. And we wanted to speak about basically our services for the services that we provide within the community. And detrimental effects of budget cuts within the Hudson Valley. So we work for, again, the Office of Mental Health. So we have a clinic in Middletown, New York and Newburgh, New York. And I'm glad that Assemblyman Jacobson is on the call as well, because we cover his constituency and area providing vital services, essential services within his and the Hudson Valley. Specifically, we have social workers, doctors, nurse practitioners, and nurses, rehab specialists that have been covering the area. We provide services for the severely and persistently mentally ill. And what that means are individuals that are in court-ordered treatment and individuals that other agencies do not want to treat. We have a housing crisis within the Hudson Valley, meaning that there are homeless individuals and mentally ill individuals that do not have housing, whether it's state agencies, group homes, or supported apartments. Currently, Orange County has a wait list of 700 individuals that are awaiting housing. Dutchess County has a similar wait list for housing. In addition, we have individuals that we treat in the community that do not have access to inpatient mental health services because of cuts that have continued over the years. We're really worried at the O agencies, meaning OASIS, OPWDD, and OMH, have continued zero balance budgets, meaning we've not had any increase in budget and continue to experience deficits with our state employees, with the potential of cuts, meaning 10 to 20% potential due to COVID and basically the deficit. The only result is going to be an increase in homelessness, an increase in violence, an increase of recidivism of the emergency rooms. Currently, I treat patients that are in the emergency room 3 to 4 times a week. Think of the cost that is costing our community. In a sense, these individuals have nowhere to go. They're court ordered, they're seeking services, they have no housing, and they're mentally ill. Severely mentally ill, so mentally ill that other agencies, including not-for-profits and private agencies, do not want to touch our patients. So we also have a special division where we also represent OASIS employees. So OASIS is a substance abuse provider within Orange County and Rockland County. It's Richard C. Ward and Blaisdell. Right now there's a waiting list for individuals to get inpatient substance abuse treatment. So any cut or any potential cut is just going to decrease beds or cut a program. And we know that the opioid epidemic continues. People are overdosing. We hear Governor Cuomo daily talking about how this COVID crisis has affected mental health, how it's affected substance abuse, domestic violence. We see individuals that are currently getting arrested because of their mental illness and in jail, and just creating this awful system and this continued system of individuals getting services or getting services in jail when they really need to be continuing services within the Office of Mental Health. Again, there's waiting lists of housing. We represent clinics. We have mobile mental health teams. We have intensive case management. And because of COVID, we have not stopped. We have not sheltered in. We continue to provide services, whether it's remotely. Not one of our offices have closed down. Individuals on the outpatient sector have gone inpatient. We've lost many patients due to COVID, and any budget cuts is going to continue to have direct effects on our community. This means people are going to be homeless. Substance abuse is going to increase. Just want to make sure I didn't cut anything out. And I know Assemblyman Jacobson, I know you're in Newburgh as well. We have a clinic in Newburgh, we have an ACT team, and we invite you to come join us, see our services and the vital essential services we provide, and defunding and continued budgets of 0% revenue are not going to help the community that you're representing. And I'm going to give it to Vincent Viernes, my colleague who's a social worker, to speak on behalf of services provided.
Hi, good evening, everybody. Good evening, union brothers and sisters. Good evening, Assemblyman Jacobson. Thanks, Christine, for speaking passionately about our cause. My name is Vincent Viernes. I'm a social worker for New York State OMH, Office of Mental Health. I've been a civil servant for about 14 years. I've been providing services to the mentally ill during that duration. I'm honored and humbled to speak on behalf of my PEF members and fellow labor activists in the Hudson Valley. I'm going to speak specifically on two programs. First one is the Sullivan County Mobile Mental Health Team. I worked for them for 10 years. Sullivan County is one of the counties in New York where services for the mentally ill are already overwhelmed. It is one of the poorest counties in New York. And my time there, and still now, the mental health services in Sullivan County is already overwhelmed. They're overbooked. There's waiting lists everywhere. Mobile mental health is able to refer clients to hospitals when they're in imminent danger to self and others. Basically, they save lives, and they provide other services when clients are in crisis. Sullivan County Mobile Mental Health diverts ER visits and hospitalizations, which is cost effective and saves Medicaid and Medicare costs. For example, a person in crisis, somebody seriously mentally ill, they just need somebody to talk to. They don't have anywhere to go to. There's a waiting list. They don't have a provider. Typically, when mobile wasn't there, they would go to the ER just to speak to somebody. We all know the cost of ER visits. Mobile mental health, we come in, they call us, 800 number, 1-800 number, and we're able to provide that support and divert hospitalization. Next, I'm going to talk about the ACT team. Me and Christine work for Orange County ACT team. We provide services to, like Christine said, seriously pervasive mentally ill, that population. We are a 9-person team consisted of nurses, nurse practitioners, social workers, a peer advocate, and administrative assistant. By the time an individual gets referred to ACT, they've had multiple hospitalizations, legal issues, and homelessness. Traditional outpatient services were not effective for such individuals. ACT provides intensive and dynamic approaches that significantly decrease and even eliminate ER visits and hospitalizations, legal issues, and homelessness for most of our clients through our advocacy, through the various interventions that we do. During the height of COVID and until today, while many agencies, like Christine said, are sheltered in, ACT continued to be in the front lines for injections. A lot of our clients are on injectable medications. You can't do that over the phone. Our nurses were out there providing injections, making sure clients have basic needs, the social workers, peer advocates, the team, basically. We were out there when the governor put in that everybody has to be out there with masks. We're out there providing masks for our patients, food, oral medications, providing interventions during crisis situations. In addition, we provided effective telehealth counseling services. But like I said, we continue to provide face-to-face interventions while practicing social distancing with PPEs and all that good stuff. We continue to provide the quality care despite a global pandemic. Mental health services as a whole is already running on bare bones, from public service to nonprofits. To further cut public services for the mentally ill will drastically put the burden on local and state inpatient behavioral units that are already constantly full. There's waiting lists everywhere. People who need hospitalization, they can't be hospitalized because there's no beds. As the country is looking for systematic changes to address the injustices to the vulnerable populations, we at PEF are concerned about the proposed cuts to state services and services for the mentally ill as a whole. It would be an injustice to cut services and funding for the mentally ill. While corporations are getting bailed out, the population we serve again gets the short end of the stick. I understand that we need revenue for the budget and the services, and I hope Assemblyman Jacobson and your colleagues are able to pass bills to generate much needed revenue and to find ways to save resources without affecting the services to the mentally ill. I want to thank you again for giving me this opportunity to speak, and I'm humbled to be side by side with the service providers of Hudson Valley and to speak for the mentally ill. Lastly, I also want to just say that I also hope that the essential workers of today, the heroes during this pandemic, did not get a pink slip for their dedication and hard work when all the dust settles. Thank you.